Hello, everybody. My name is Dr. Miriam James, and I'm here today to talk to you guys about hormone replacement therapy. I wanted to touch on three major questions that I know people have about this topic, and that is, what is it, why is it important, and how do we treat it? The normal age for menopause ranges between age 35 and age 55. As we age, we start to lose our sex hormones, estrogen, progesterone, testosterone, pregnenolone, and also we start to have difficulty with stress hormones, DHEA, and cortisol. As a result of that, people have subtle symptoms that start to become greater as we get older of mood swings, obesity, especially around the midsection. For women, there's vaginal dryness. For men, there's loss of erection. You also have decreased libido. You have hot flashes, which are vasomotor symptoms, and the list just goes on and on. We are going to continue to have this discussion as far as delving into the other questions that are associated with this topic. This is all part of longevity medicine that is the breakthrough of the future as far as us having a good quality of life and living longer and living better. Thank you.